Does Zepbound cause anxiety? It's a question a lot of people have, whether they're just starting the medication or thinking about it. And it makes sense to ask because understanding how any medication might affect your mental health matters. So let's walk through what the clinical evidence actually shows. Zepbound, the brand name for tirzepatide, is an FDA-approved medication for chronic weight management in adults with obesity or overweight who also have at least one weight-related health condition. It works by activating two receptors in the body, GIP and GLP-1, which together help regulate insulin, reduce appetite, and slow digestion. Now, to the main question, does it cause anxiety? Based on current clinical data, the answer appears to be no. Anxiety was not identified as a common side effect in the SURMOUNT clinical trials, which involved over 5,000 participants. The most frequently reported side effects were gastrointestinal, things like nausea, vomiting, and diarrhea. And FDA labeling for Zepbound does not list anxiety as a recognized adverse effect. That said, there's an important nuance worth understanding. Some of Zepbound's known side effects can actually feel a lot like anxiety. An elevated heart rate, for example, or symptoms that resemble low blood sugar, shakiness, lightheadedness, a sense of unease, can mimic what anxiety feels like physically. It's worth knowing that these low blood sugar-like symptoms are more likely if you're also taking insulin or a sulfonylurea alongside Zepbound, so ask your doctor about your specific regimen. If something feels like anxiety while you're on this medication, it's worth having that conversation with your healthcare provider to figure out what's actually going on. On the broader question of GLP-1 medications and mental health, the FDA issued a safety communication in January 2024 after reviewing this exact concern across the GLP-1 receptor agonist class. They found no evidence linking these medications to increased suicidal thoughts or actions. The FDA does continue post-marketing surveillance across this class and related medicines, so this is an area that's actively being monitored. So what should you do with this information? If you're currently taking Zepbound and you're noticing new or worsening feelings of anxiety, bring that up with your healthcare provider, especially if symptoms are severe or persist beyond about 2 weeks. Don't dismiss it, but don't assume it's definitely the medication either. Your doctor can help determine what's actually driving what you're experiencing. It's also worth being open about any mental health history before starting Zepbound, so your provider can monitor you appropriately and personalize your care. And please, if you ever experience severe or persistent anxiety, or if you have any thoughts of self-harm or suicide, seek help right away. You can call or text 988 to reach the Suicide and Crisis Lifeline, or call 911. Don't wait for a scheduled appointment. To recap, clinical trial data does not establish anxiety as a recognized side effect of Zepbound. Some physical side effects can mimic anxiety symptoms, so careful evaluation matters. And if anything concerns you mentally or emotionally while on this medication, talk to your doctor. Nothing in this video is a substitute for personal medical advice. Your healthcare provider is the right person to guide your treatment. If you found this helpful, drop a comment below with any questions you'd like us to cover. And if you want more evidence-based content like this, make sure to like and subscribe.